thank you, everybody. This is Maria De Leon. I am really excited to be here. Thank you, Elena, for putting up with me and for inviting me to the Rocky Support Group. I know this is early, so everybody that's joined, I appreciate you coming in. We've been having a little difficulty with this slide, so hopefully we can get everything going. If not, maybe Elena can help me to be able to go to the slides, because I can't seem to forward them. But I will start. Today we're going to be talking about the balancing act and Parkinson's era. In the Parkinson's and the era of pandemic, which we're all just been, this year has been crazy. So I know that you guys probably have lots and lots of questions. And again, thank you for being here. So, you know, in a crazy year like this year, we want to be able to find a way not just to balance and stay with our Parkinson's well controlled, but also to be able to stay safeguarded from the current pandemic and also continue to live our lives. So we can't have a Parkinson's talk without much talking about, you know, a little bit about Parkinson's. I'm sure you've all heard this before, so it's not anything new, but, you know, Parkinson's disease has been around for at least 5,000 years that we know of. It's been mentioned in books. And of course, Dr. James Parkinson published his essay about 200 years ago, describing, you know, the symptoms. But for this whole time, we have thought of Parkinson's as a movement disorder. We have thought of it as mainly, and it's still mainly diagnosed by a 4 clinical cardinal signs that are established by the UK criteria of the brain. And those signs, I'm sure you're all familiar with, are balance and gait issues, rest tremors, bradykinesia, and rigidity. But we know that Parkinson's is so much more than that. Parkinson's is a complex disease that involves both motor and sensory features. So the sensory, some of the sensory problems are olfactory loss, constipation, sleep disorders, depression, anxiety, fatigue, pain, many of the things that we really didn't consider to be part of Parkinson's, or rather initial presentation of Parkinson's, till not that long ago. So now, fortunately, the science is moving to being able to detect both the non-motor and the motor, and perhaps early diagnose, because oftentimes patients present with non-motor symptoms up to 15 years before the motor symptoms present, and so before we can actually make a diagnosis. So it is important that we've had this great discoveries in the last 10, 15 years. We've been moving more forward towards understanding the non-motor symptoms, and perhaps in the future, you know, rather than a neurologist, we may have other fields diagnosing this disease. Because it is a complex disease, it still takes sometimes 5 years in young people and women particularly to get diagnosed. So we're trying to understand Parkinson's better and how we can diagnose it early so we can start treatment, and also start research, but mostly treatment, because, you know, 10 years, 15 years of living with a disease, that's a lot of time of disability and discomfort and pain that we can try to alleviate and help people live better lives. So in the past, and even today, we call Parkinson's idiopathic, and that's because we're idiots as doctors, as neurologists, and we really don't know the cause. We're learning bits of the puzzle as we go along in this last 10, 15 years. The science has improved dramatically. Genetically, there are about 15% of patients have a genetic form, one of the 7 identifiable genes that we have available. That's the PARK7, the LRRK2, the NCA, the PARK1, and the PINK1. And these usually are familial by mutations or alterations in the family. Most of them are autosomal dominant, but some can be recessive. And of course, there's the GBA gene that also can affect people that have Gaucher. The thing with the LRRK2 gene and the Gaucher is that not all people that have those genes will develop Parkinson's, but they can have other illnesses like migraines or other autoimmune diseases, or as I said, more prone to different cancers or Gaucher. So just because you have the LRRK2 or the GBA does not mean that you will have the disease. But if you do have the disease and you have that gene, then that's most likely the cause. The other piece of the puzzle that we used to think was a greater part of it was environmental. And we know that there are toxins in the environment, especially at paraquat, we've been talking about that can increase the risk of Parkinson's. So now combine the genetics with the environment, we're getting a better picture. But we think that perhaps there's more genetic abnormalities. And now, as we speak, there's underway a large PD generation study that is being sponsored by the Parkinson's Foundation that will help us determine if there's other types of genes that we have not missed to date, or if there's a greater increase of genetic variation or diversity leading to Parkinson's. So, as I said earlier, how do you diagnose Parkinson's? Well, there's me, neurologist, movement disorder, usually requires the criteria, as I said, the 4 cardinal symptoms, the motor symptoms, and it's a clinical diagnosis still. Unfortunately, even up to date, there's no biomarkers that we can say specifically with 100% certainty that this is Parkinson's other than a brain biopsy or autopsy. So we don't usually do that. So lately, there's been a debate whether there's the diagnosis of Parkinson's if it's one disease or multiple diseases that have similar presentations. Recently, within the last month, there was a report, and I don't remember which journal it came out of. They said that there's suspect 2 etiologies of Parkinson's. One is one that initiates in the brain, and the other one is one that initiates in the gut. After all, the gut is the second brain. However, I think there's probably multiple other etiologies, but we still, right now we're getting better understanding. We know that people think that it may originate in the gut because, many people, or most of us, start with constipation and GI problems long before we have the diagnosis of Parkinson's. And after studying some patients that have had total vagotomies, means the connection of vagus nerve from the brain to the body, to the gut, there has been a decrease of occurrence of Parkinson's in those patients. So again, giving more credibility to the fact that it may begin in the gut, although the vagus nerves runs in both directions. So, we will have to wait and see if that's the case. However, another thing that makes this theory more credible is that we know that the biome of the gut, the bacteria of the gut, differs in patients that have Parkinson's from those that don't have Parkinson's. And also we know that patients that have a particular bacteria can have worse Parkinson's. So there may be a gut etiology, as they say. So we know that a bacteria called fecal bacterium, those that had that type of bacterium had decreased symptoms of Parkinson's, as well as another bacteria called Ralstonia. So having this bacterium decreases the risk of having Parkinson's. While another bacteria called the B. bacterium fragilis, or the bifidum bacterium, worsens Parkinson's, particularly that of motivation and initiative with the fragilis, and the hallucinations and delusions with the bifidum bacterium. So there may be a correlation. There are studies where they're doing fecal matter transplantation and studies that have proved to be that have improved symptoms. So that's still ongoing. The other thing is that we know that we are what we eat. We heard our mom say that, be careful what you eat, because you turn, if you eat a lot of potatoes, you're going to turn into a potato. So people that eat a lot more probiotics or yogurts, or have a healthier diet, more Mediterranean, tend to have a better cognition than people that don't eat probiotics. There was a study that was done on normal people, young people, and they looked at the diet, and they looked at MRIs and PET scans of their cognition, their function, how their brain lit up. And people that remain on the yogurts or probiotics, they stayed on that, and people that used to do a lot of junk food and other fatty foods, they were asked to switch, and after a week, they noticed that the people that switched also had improvement in their concentration and their brain scans. So definitely what we eat has an impact on our lives, and can have an impact on our Parkinson's disease. So sometimes it is good to perhaps take yogurt or probiotics, but discuss with your physicians, because some of these probiotics can be, especially the ones over the counter, if you have other chronic illnesses or other illnesses, it can worsen those symptoms. So one of the ones that I like to use is called Foragen. You keep it, buy it without a prescription at a pharmacy, and you keep it refrigerated, and it seems to have really good effect without causing the fevers and chills that some of the other over-the-counter ones may cause. So again, Parkinson's diagnosis, still clinical, still depends on a physician. Movement disorder specialists are able to identify by 95% certainty when patient has the symptoms. However, sometimes patients may come in very early and may not have all the 4 cardinal symptoms. So the diagnosis is not made, although suspicion is made. And because there's no biomarkers, it's hard to say 100% whether this will be Parkinson's or an atypical disease. So as we know, because of the presentation of the non-motor symptoms and the young and the age of onset, we used to think it was primarily men that is in their elderly years or older years, over 65, idiopathic Parkinson's. However, we do have young onset Parkinson's, 45 and younger, usually 40 and younger. And they seem to present a little bit different, more non-motor. Because all Parkinson's patients look different, we need to approach the treatment differently. Not everybody tolerates the same type of medications and can have the same treatment. We have to, when considering how we're going to treat it, we not only have to consider the symptoms, but also our other social engagements, our other our status in our life, where we are in stage of life. Are we young people beginning careers, marriage, families, or are we, in our later years where we have already, raised children and already retired? And so that may prompt different types of treatments because of the demands of what our demands on society are on us and our family demands. So it is important that we keep that in mind, that fortunately in the last 30 years, we've had a lot of advances. So there is life after Parkinson's. I know that sometimes when we get that diagnosis, and especially I did that too, you get a little bit sad about, your life is changing, your life will never be the same. But the fact is that life is always, we're constantly changing. Change is the only constant. And it is the.
Sorry to interrupt, Dr. Leon, really quickly. We're not seeing your advancing slides for some reason.
Yeah, I'm having a hard time with this, and I'm not sure where they are. Okay, let's see.
There we go.
Did you see that? Can you see that?
I do.
Okay.
Thank you.
You're welcome. I'm trying.
Sorry to interrupt.
I can't see it advancing on my side either. That's why I'm really, it's hard. Okay, so I apologize. So change is the only constant. And so sometimes it's not the strongest of the species that survives, nor the most intelligent. It is the one that is most adaptable. And I think that life, you have to be adaptable. Nobody expect a year 2020 to happen. So in order, if we're going to not just survive, but thrive, we need to become more adaptable. The same thing with having a chronic illness, with having Parkinson's disease. We have to find a way to engage in life. And it's okay to be sad. It's okay to mourn the loss, to feel for something that now you have to deal with. But then we have to move on. We can't just sit around and do nothing and wallow in self-pity or be angry, because it's counterproductive. That's only going to keep others away. It's going to make you bitter and sad, and it's not going to be beneficial to your health overall or improving your outcome. So best way is to open your arms, open your hands, and let go of that. Like a balloon, release it. You can't keep doing everything. If you're always constantly holding on to the Parkinson's in one hand, you're limited to what you can do. So you got to open your hands and let go of it and embrace it. My husband, wise words, my husband told me when I was having the diagnosis and I was embarrassed to go start physical therapy because my patients may see me. And then I realized that, this is what I recommend to my patients. This is what I think is the best thing. So why am I being embarrassed? And how do I expect people to go out and live their best lives and change from the inside out if I myself can't do what I'm teaching and feel embarrassed? So you have to embrace it. You have to find a way to make it yours, to make it unique, and to put your own talent, gifts, personality into your diagnosis and find a way to thrive. It's an opportunity to reinvent yourself and to do things that you never did before, never dared before, never thought you would do before. And if you do that, I think that you will find that you will be a lot happier and a lot more able to persevere. So the thing is, are we the type that are glass half empty or glass half full? Sometimes, actually in life, how we survive, how we thrive depends on our life's view, how we think. Our thoughts have positive or negative effect on us. So we're constantly thinking negatively, negative things are going to happen. If we're thinking positive, then we are open to solutions and open to seeing the world from a different perspective and see positive outcomes. So anytime that you have that negative thought come into your head, oh, I have Parkinson's, I'm not going to do well, what's going to happen to me in 5 years? Stop. Change it. Say, in 30 years, we had all this advances. We will have new advances. We will have new cures. I'm doing well so far, or, there's new treatments, and I will be able to go on. Those people that have a half full mentality, they're more creative, they're decisive, more patient, more adaptable, and more playful. Well, guess what? Having Parkinson's, it's a great benefit for having a half full mentality, because Parkinson's and all that dopamine improves creativity and improves that able to just decide and tell it like it is. So I think that if we keep our minds open, we may be able to move forward and not look at this as a life sentence, but rather an opportunity to improve, to change, to do new things, and still live a full life. I am an example of this. I thought my life was set. I have been training to be a doctor my whole life, spent my entire career training for this. And I saw myself, practicing neurology, treating Parkinson's patients till I was, old and gray. And little did I know that I would still be taking care of Parkinson's, dealing with my own Parkinson's. So when I got the diagnosis, my thing is like, well, what am I going to do if I can't do neurology and Parkinson's? Well, I'm still doing Parkinson's. I just do things differently. So I never knew that I was going to become an author. I never knew that I was going to become a model, and all these things that I have learned and wonderful people I have met. Once I decided that I was going to embrace my illness, and not only do I have one illness, but I have also lupus. So, if I can make it, then you can make it as well. We can move forward. It's about making the right choices, prioritizing yourself. I've had to do a lot of introspection. What I used to be the caregiver, that was who I was and still who I am. I am always taking care of people by being a doctor of nature. That's my personality. But I had to make time for myself and realize that, you can have everything that you need. We can have everything we need, but not everything we want. It is impossible. Even if you're the healthiest person in the world, you cannot have everything and do everything in the world. There's just not enough time. There's not enough capability. So you have to decide what it is important to you. For me, it's my family, my God, and working with Parkinson's and working with Parkinson's patients and spreading neurology. And so those are my things. So you have to be realistic in your goals and also know yourself. So there is that introspection. You have to, in order to heal and move forward, you need to spend time with who you are. As uncomfortable as it may be, I had to do it as well, who we are, and be honest with ourselves. We have to live with ourselves. So we have to like ourselves first and know our limitations. I was stubborn, very stubborn in the beginning. I did not want to admit that I needed help. I fell a lot. And I learned that, I have to listen to my body, and it's okay to ask for help. It's okay to not be the one in charge. So let others help when they can. So always keep goals and reevaluate goals. Do 1 month, 3 months, 5 years, 1 year, blocks of time goals. And what do you want to accomplish? Where do you want to be? When deciding what needs to be at the top of the list, pick 3 things. For me, I pick, my family, my mental health, my spiritual health. I want to be there for my daughter's graduation. What do you want to do, in 3 months' time? You want to get your Parkinson's under control. You want to get Parkinson's diagnosed. You want to be able to not have a walker. You want to be able to, run a marathon. Whatever your goal is, then go ahead and set it and work on that goal. Having short-term goals always helps to improve and release those neurochemicals that are in our brain. There's serotonin, endorphins. It gives you something to look forward to. And when you accomplish it, even if it's a small thing, like today, I'm going to be able to dress myself fully without assistance. And when you accomplish that, it is a big thing, even if it's a small accomplishment, like getting dressed, or putting on your earrings, or putting on your makeup, or shaving. That is important. So the other thing is remembering that this is not the end of our life. And I have been a neurologist even when there was no treatments in neurology. Friends laughed at me because they said, "Why are you going to be a neurologist? You're going to diagnose and adios." And fortunately, there's been the big change of the brain decade and the science, and there's been a whole surge and flourish in the last 30 years in neurology of new understanding of neurological disorders and new treatments and medications for Parkinson's. I was still in my training in the 90s when the first dopamine new medicine since 1968 that was approved and came out to the market and came out to the scene to make people's lives better with Parkinson's, the dopamine agonist. The first one was Mirapex. Since then, we've had Mirapex Extended, Requip, Nupro. We have a bunch of dopamine agonists. And then we had, we had Comton, Tasmar. We've had a whole lot of new medicines. Then in the 2015, there was another revolutionary time. Ritari came out, which is the better intermediate control of the dopamine, dopa release medications that has a particular mechanisms that releases small pebbles at particular times so that you don't have those peaks and troughs with the regular Cinemet that we had. And because it's released, you don't have as many side effects with it. And also, you don't have, even because the CR was not as consistent linearly as we wanted to, there were still some fluctuations and peaks and troughs. So the Ritari gave us more of a smoother. And to me, that was a life-changing. When I started Ritari, as soon as it came out, even my neurologist, who's been my colleague and friend for years, has known me even before I had the disease, she looked in my eyes, she said, "Maria, you're back." And I was back. My brain was functioning again like it used to, and I was able to, and I'm able to do what I do now. Doesn't mean it's perfect. Doesn't mean I still don't have ups and downs. Of course, like I said, I have lupus as well, so it's not always peaches and cream, but life is a whole lot more manageable, and I'm able to do the things that I need to for most of the time. Then the new medicine that were just approved this year is Kiombi, which is I'm really, really excited about. Is the one that is the thin slit that you film under the tongue. For those people, it's an apomorphine that you have fluctuations or dyskinesias, you need a quick on or off, rather quick on because you're off. And so I'm really, really excited about that. And the other medicine is Nurians, which has been out for about a year. It's not been used very much, but it is exciting because it's a different class of medications. It's the first adenosine alpha-2 receptor. We have alpha-2 receptors in the brain and the body, but this one is particular for the brain. And what it does, it puts the brakes on those motor symptoms and those fluctuations. So I'm very, very excited that those new medicines have come on board. Other treatments that have surfaced, so how do you treat it? So the best medicine, as I said, there's not one treatment for everybody. We're all different. We experience different symptoms, and I think that's because we have a different disease. It's kind of like cancer. You have cancer of even cancer of the breast. There's different types of breast cancer. So I think we're dealing with different Parkinsons, so that's why we all look different. But fortunately, the more medications and treatment we have, the more options we have. So But I want you to remember that it takes time to find the right regimen. Even myself, as a physician who knows the medicine, who's a Parkinson's specialist and knows the medicines well, treated many patients, just because I know how they work doesn't mean that my body agrees with the way they work or tolerates. So it took me a while, over a year, to find the right combination as well that I could tolerate and I could function. So I want you to be patient and not give up and not say, well, that medicine didn't work, or, that doctor didn't know how to treat me, or, so be open to trying different things and know that it's going to take some time to do it. And every time there's a change, there may be, again, a little bit of time to find the right treatment. Fortunately, we have more treatments, but also that means there are more combinations to try, which sometimes I know, as being patients, you and I feel like we're guinea pigs. We're constantly trying new things. We're tired. We want to get better. We're sick of feeling sick. And so we get a little impatient. But let me tell you that the best thing to do is to try to find a doctor that you like, that can talk to you and you talk to them, they listen, and stick with them and try different medicines. And sometimes, even though you might have tried a medication and said, well, I didn't like that, or that didn't do well on me, that didn't help me, sometimes in a different combination, it will be just the right thing for your symptoms. So don't be afraid. And remember, we have our brain, our dopamine, is kind of like having, for instance, I live in Houston area. And I have dopamine all around me in Houston. So it's no problem if I, get dopamine initially, from the north part of Houston, the south part of Houston, where it's all in Houston. I get dopamine. So whatever you treat initially, decide to treat, you will respond. Initially, you will respond to whatever they give you, because you have the dopamine still available. You have the potential to make use, have the potential to absorb it. But then as time goes by and the Parkinson's worsens, then, the dopamine around you, the suppliers there in Houston, begin to not work as well. They're not always on time, and so they're running out. So then you need to go outside, maybe, a little bit further in the state. So then you add other medicines to help with that. You add monoamine oxidase inhibitors, you add Comten, you add dopamine agonists, you add, perhaps DBS, other things to help improve and maintain that supply that you need. But then again, they run out. So now you have to go outside of Texas, and you need to import your dopamine all the way from New York. And at first, the train is running fine, that gets there every single day at 4 o'clock, and you can count on it. But as time goes by, the train starts not getting there, or perhaps, it gets there 2 hours late, or maybe, half an hour late. And that's when people start having the motor fluctuations and the dyskinesias. And that's when we need other types of medication and other types of ways to maintain that constant free-running source of dopamine to our brain. So one way is medicines, and the other way is to do surgeries. We have, fortunately, lots of surgeries. We used to have pallidotomies, stylodotomies, which are still done in some parts of the world, particularly if there's no access to movement disorder specialists, or there's no DBS training. So that may still be the only choice, and they work very well. However, with those, they're static and don't have the opportunity to adjust treatment, or to change to something else later on, because you will have a permanent lesion there. So when DBS came out, again, it's been out for over 20 years. It was approved when I was in training. So Medtronic's was the first one. It is still the best. Treatment is reliable. and it works very well. Now we have St. Jude's and we have the Boston Scientific. So you have lots of options of DBS. And the one thing that has come out recently is that now we have what we call a closed loop adaptive DBS. Which is you only use that wire impulse in your brain when you need it. So you have the capability to control what you need and how you use it, your brain and yourself. So FDA just approved an iOS implantable app. Compatible app, not implantable, compatible app for personalization of DBS management. I think that in the future we're going to be seeing this more often than not being used. So things to consider are when you're doing DBS is how far you live from a center. Do you have the support for people to drive you? Because it may take about 6 months initially to adjust it. And then every time there's a change, there may have to be some adjustment that may take, again, a few months. So you need to be able to have access to centers and also a support system that's going to help you. I think cost, for the most part in this country, Medicare has covered for most, so that I don't think is a big issue. Perhaps for the new ones, perhaps for the ones with the closed loop, but the Medtronics for sure there's unilateral and bilateral. And think about the battery life. What kind of activity? Are you an extremely busy person that's going to be using this a lot, so the battery is going to run a lot faster, or somebody's already retired and doesn't need to have such great charge and input? Then, of course, there's the surgical candidate. Are you a surgical candidate? I, for one, I have too many medical issues that even though I have Parkinson's that would improve with DBS, I'm not really a good surgical candidate. So fortunately now we have ultrasound, focus ultrasound, and we have other things that may be in the loop, such as Duopa, to help us with that. The other things to keep in mind, and your doctor will probably know better, but it's important to be aware and to know when you're talking to your surgeon about where the implant is going to take. There's two sites where they do it. There's the subthalamic nucleus and the globus pallidus. The globus pallidus in general seems to be better for dyskinesias and for medicine adjustment if you're having trouble adjusting your medicines. However, if you're having a lot of side effects with the medication, you're not able to tolerate medication, and you want medicine reduction, or you worry about the battery costs, maybe the subthalamic nucleus is the better site for you. So those are things to consider. Of course, Parkinson's, like I said, is a complex systemic. We're just seeing the tip of the iceberg. We have a whole lot of issues underlying. So we need more. It's not just a movement disorder. It's not just motor symptoms. So we need other ancillary treatments. So we have to make sure that we talk to our doctors about making sure that we sleep well. All Parkinson's patients have shift in their sleep. I, for one, used to always be a night owl, and I would go to sleep between 12 and 1. Now my time for sleep is about 2 to 3. So it shifted over, but I don't sleep unless I take a sleeping medicine. So you need to, and I think that that's one of the main reasons that people get brain fog, and frog too, but fog. And also, they get memory loss, poor concentration, and may be a risk factor for dementia because we don't sleep. The brain requires that downtime to clean all the trash out so it doesn't accumulate. You will feel better, I guarantee it. Constipation and nausea are big things in Parkinson's with the medicine and with the disease. So make sure that you talk to your doctor. There's lots of treatments for this problem so that you can find the right treatment for you. If you're in pain, sometimes just adjusting the pain medicine, not the Parkinson's medicines, the dopamine, that will solve the issue, but sometimes it may need some other pain medications. Likewise for memory problems. Don't be afraid to ask if you are having memory problems, to make sure that there's no other underlying problems causing the memory issues, but also that if it is the Parkinson's, that it is being treated appropriately. So now we are worried. We have Parkinson's, we're living with Parkinson's, and now we're living in the middle of the pandemic. What do? Are we more prone to get the disease? Well, we're not more prone to get the virus compared to others. However, it is more virulent more virulent than the flu. The flu is more contagious. We had 45 million people affected with flu last year, but only 61,000 deaths. Comparison so far this year up to this moment, we've had 34.5 million cases of COVID, and we've had over 1 million deaths, so a lot more virulent. As far as Parkinson's, like I said, we are at equal risk of getting it. However, it does increase with age. So those over 65 and over are at higher risk of getting the virus. But among the Parkinson's patients that do get it, then those that do get it have a higher mortality. So it means that you're as likely as anybody else to get it. But if you do get it, you're going to be sicker, you have a higher risk of being sicker, 30% mortality. And this is mostly, again, in men and older men over 75, as a study of 80,000 people that was just published in the Movement Disorder. So what do we need to do? We need to limit our interactions with people as much as possible and use safe measures. Keep that social distance. I think that the reason that we're not more readily contracting the disease, I think partly is because we people that have chronic illnesses know that we are more frail, and we try to avoid people and maybe stay in more. I certainly have. I have become a hermit. I don't go out very much. And so I think that that's a good thing. But things that makes us at risk, particularly, well, one, having a chronic illness, two, if we're older, but those of us that have chronic illnesses and have Parkinson's tend to have vitamin D and B12 deficiency, both of which can affect the immune system. So make sure that your doctors are checking your B12 and your vitamin levels, and then if they're low, that they're replaced, because that's going to boost your immune system. Again, lack of sleep. Sleep is the biggest factor in worsening our immune system and lowering our immune system and increasing inflammation. So we want to make sure that we sleep, that we find a way to rest. Even if you go to sleep like I do at 3 o'clock in the morning, make sure that you sleep 7 hours. So you may go into the morning, but you have to alter your schedule and your lifestyle so that you're able to maintain that ability to function and stay well and stay healthy and sleep. So just like with any other illness, anytime we get any other illness, whether it's viral, infectious, bacterial, or any other underlying medical issue, it is a lot harder to recover from the illness because of the Parkinson's than not having the Parkinson's. So again, keep the measurements of safety, distance, even when you have people to the house, keep the mask on. If they are not living with you, and even if they're living with you, if they look like there's somebody sick, then don't be in close proximity. Don't touch your face, don't touch your nose, your mouth, your eyes, and wash your hands often. And always make sure that you always are in touch with your physician. So even if there's a change in your symptoms, whether maybe some of them may be similar to changes in Parkinson's, the symptoms of the virus, make sure that you contact your physicians and let them know what's going on. Make sure that you are proactive and don't wait until you're having trouble breathing or walking or falling or mental fog to contact the physicians. Being proactive is the best way to avoid this. So, so how do we live better, fear less, and live more with in the current state that we live in, and also in this with Parkinson's? So there's a lot of stress and anxiety just having an illness, chronic illness, but even more so when we live in an era of uncertainty as it has been this crazy year. So remember, fear is part of being human. You're not alone. So don't think, oh, this is only happening to me. There's something wrong with me. It is normal. The normal thing is not to keep giving into those emotions and keep reacting and going into a depressive state or anxiety state. So be vigilant of your emotions. When you start feeling yourself, you're revving up, your heart rate is going up, you're getting anxious, you're getting depressed, stop what you're doing, find a way to distract yourself, watch a funny TV show, listen to some soothing music, don't watch the news constantly, do some gratitude journaling, what's been good in your life, do some doodling, some mandala journal, do some painting, sometimes just some coloring, mindless coloring. You can do it on the apps, they're free, or you can buy some coloring books and just color. Distract your mind from that anxiety. Another way to decrease that pain, that anxiety and depression, or that anxiety, what happens if I get sick? Have a backup plan. Stay connected. Have somebody that knows what's going on. Talk to a person, a friend, a family member every day, so you know what's going on with them. They know what's going on with you, and so that you don't feel disconnected and alone. Stay mentally active. Learn new things. Whatever it is. It may take you 2-3 times longer than everybody else, but in the end, you'll be happier because you learned something new and you were able to distract yourself. And those are the people that are able to adapt and move on and do better with the disease. Having a pet, get a pet. Having my little cat has been the best thing. When you feel kind of stressed, play with them. You love on them. Don't get too close, or if you do, again, wash your hands well. Make sure they don't get in your face too much, or wash your face so that in case there's any potential for virus transmission, that you're minimizing that. And laugh. Find ways to laugh. Laugh with friends, or maybe just laugh out loud. Even if you don't feel like it, sometimes that's when we need to laugh the most, and that will improve your feelings of decrease your anxiety and depression. So maintaining good boundaries is key for living well within the disease, living well during these times. So start with self-love and soul-care. Sometimes we forget to love ourselves, or we think it's selfish that we are loving on ourselves and that we prioritize ourselves. But if we don't take care of ourselves, then think you can't take care of your family and those that depend on you. And also you're going to be maybe a bigger burden or end up in the hospital. So start with some self-care. Start with that downtime. And think about when you are doing your boundaries, what are the self-awareness, my rights, my obligations, and my needs? It's okay to ask for help, but it's okay to say, no, I'm not available to do that. maybe ask me next time. You don't have to jump into every opportunity. And the same thing, people sometimes, they say, well, exercise is really good for me to do Parkinson's, and that's great. But sometimes they push it over the limit where they're feeling sick and down, and they try to push their body, and that's how we end up in trouble. Listen to your body. Listen, if your body says, today is not a good day, today I need to just stay in bed or stay in my PJs or rest, then do that. Give yourself that luxury, that time to just say no and listen to what is going on. Our body is very, very smart. God created us to be very smart. Our body always tells us what we need when we're low on electrolytes, when we're low on rest. So make sure you pay attention. And also, do strengthening boundaries. What do I need to do to regain control? Do I need to talk to somebody? Do I need more medication? Do I need to spend more time alone, more time with family? So do what it takes to feel better and keep moving. This is a great time to be in neuroscience, to be, with Parkinson's, because again, like I said, there's new medications, new understanding, and I'm very excited to be a neurologist and be part of this community, Parkinson's community. We have started a chain reaction. We're like this axons. We keep moving forward. Where the more people we link with, we form a chain, and we can move, that saltatory moving with, jump from one person to another, and strengthening one another, lifting everybody up. So remember that those who are happiest are those who are involved in the service of others. So part of the boundaries and living well is, after caring for yourself, then, spend time not thinking on your disease, but thinking of others. Find your gift and share it with the world. You are unique, each one of you, and have lots of talents and gifts that would be wonderful if the world could see what you have to offer. Sometimes you may feel, well, I'm not quite ready. Well, that's fine. Get yourself back in working order before you go out and try to help somebody else. But once you get yourself feeling well, don't sit around just moping and saying, well, I have this Parkinson's. Well, you have a life, and then you have Parkinson's with it. We all have something, whether it's diabetes, hypertension, Parkinson's, everybody's going through something. So the best way to boost those neurologic endorphins and serotonin and dopamine is to be involved in the service of others, is to help others. So what can you do? You say, well, I don't know if I could do anything. Well, sometimes sharing your story, just sharing what you've overcome, what you've done, that is a way to help another person. Be a mentor to one person, to somebody that's just starting the journey. If you've been in the journey already a couple of years, maybe somebody that's just starting. Partner with the healthcare profession, or be a research advocate, a public policy advocate, be an influencer. You can, now that everybody's home, maybe have some time to blog or to do some influencing or do some research online advocacy. There's many sites where you can give your opinions and do research without having to go to institutions. You can participate in this PD Gene. You can just participate on the Fox trials. Anything that, to help keep your mind off of disease, but also to help others and to do something fun. But not just think about your life with Parkinson's, but also your life as a mom, as a dad, as a father, as a brother. Play with your children, with your grandchildren. Spend time with your friends, with your pets. Do things that would enhance your life. That's what living well and thriving is about. Whether we have Parkinson's or just trying to live with other diseases or just cope with the virus. So we need to start, of course, with balanced nutrition. As I said before, we are what we eat. So don't forget that. To always, and it's important not just what we eat, but also I think for Parkinson's that we have a very slow digestive system, to eat meals at a regular time, especially when you take medications on a timely basis, to make sure that you don't overeat or eat very late at night, because it's very slow, especially as we get older, to digest food. And I think that that's one of the biggest problems, at least for me, that if I get out of a routine of eating my normal 3 meals a day, if, when I travel or I do have to get very busy and I eat late or I skip a meal, that's when my GI symptoms flare up. So make sure that you keep that open mind when you do that. And again, have a backup plan. Be prepared in case necessity should arise, if you should go to the hospital or you should move, or you need treatments, or or whatever for the outcome for the Parkinson's, so that if you have to go to the hospital or if you have to move to a facility or live with somebody else, that that you have everything in order. You want things to be done the way you like them to be done, so you don't want to give this this burden. Also, make sure that your wishes are met. So have it in writing, or assign somebody ahead of time. Keep your doctor's numbers handy. Keep a list of medications. Keep a small suitcase or bag with essentials like medicine. I always keep my 2 sets of medicines, one in a bag that's ready to go at any time, and one in my medicine cabinet, where I take my medicines every day. So in case I have to go, then I know I have all my medications with me. Keep the name of you and numbers of who to contact in case of emergency. That be a friend, a family, a loved one. Especially if your family is far away, make sure that you have somebody nearby in your vicinity, in your neighborhood, in your city, where they can be more readily available to help out in a time of need. And make sure that you keep all important papers like marriage certificates and wills. Try to keep it in an organized binder. I know not all of us are very organized. I know I'm not. Thank God for my husband, keeps everything in a binder organized, so that you know where it is. Have somebody help you if you're not organized like me. Make sure it's a waterproof, fireproof safe, that you have ready access, so people also know where they are, whoever's going to be your contact, so that if something happens, they know how to access this important information. So assign someone to be the trustee of your will, the medical executive, and have this in place. It gives you peace of mind. So if something should happen, you know what, you don't have to worry about those things, and they can convey your wishes. So in the end, living with Parkinson's and balancing, it is a balancing act. You can have everything, but you can't have everything you need. And you find if you really prioritize, you have everything you want and need. So in the end, in the confrontation between the stream and the rock, the stream always wins, not through strength, but through persistence. And so you have to persevere, and sometimes we have to take it even 1 minute at a time. If you have to stay in bed, don't stay in bed forever. It's okay to cry. It's okay to shout. It's okay to hide a little bit, but then you have to move on, and you have to keep going, and have to find a passion, find a reason to get up and go. And my things, I become the Parkinson's diva. So, I'm a fashionista at heart. I love fashion. I love art. And so I'm a neurologist. And so I have to find a way to combine all my talents and be able to show Parkinson's who's boss. And you can do that. Find your uniqueness and show it that you're in control, and that even though days may be tough, there is sunshine ahead, and there's a way to make it through. So I think with that, we are ending. We all have a new dream inside of us. Remember, there's always a new dream. Find out what yours will be, draw it, write it out, and start working towards the new goal. We have lots of time.
Yeah. Well, actually, we are at time right now, unfortunately. So
Yeah, I'm done.
So if any of you who have submitted questions, we will get those answered for you and get that get going with our next session. Actually, I'm so sorry that we.
Oh, that's okay. I'm sorry I went too long. Yeah.
No, it's okay. So we'll go ahead. Up next on the main stage is a Energize break, and we will get your questions answered for you. But be sure to check out Dr. De Leon's blogs. I've posted those in the chat. And thank you again so much for presenting for us.
Thank you.
Thank you. I know one of the questions was there was that refrigerated probiotic.
And there's 4 different doses, and it doesn't, I think I've tried the one that was 13, the first or the second dose. You can try any of them. They're all perfectly fine. So it's just whatever works best for you.
Okay.
I've never really had to go to really high doses, but they're all safe, and it's okay to whatever they have available. Sometimes not all pharmacies carry all 4 strengths.
Right. Okay, cool. So this question comes from Krishnan, and he asks, when you were discussing the DBS systems, he says, are rechargeable batteries for DBS better than the 5-year life batteries?
Well, they're getting better each time. They're getting smaller and they're getting longer, but it depends on the person and the type of illness they have and what they're controlling. Sometimes even though they have a 10-year battery, it may still run up, in 5 years, depending on how much is being used, what the, how much dyskinesia is or most. So that's something that you need to talk with the doctor, about, replacement and things like that. But they're longer and smaller, which is good, but still depending on the person. And I think that's why this one that is closed loop and that you can monitor, it may last longer, because then you only use it when you need it. So if you don't need it all the time, you can adjust it yourself so I think that may prolong the battery life. So
okay, it's kind of
who
knows. And I should also mention, anybody who's tuning into the lunch session, if you do have any follow-up questions for Dr. De Leon, you can navigate over to the Q&A tab on your screen and type in your question there. We'll get through the ones that were entered during your session first, and then we'll kind of hit those ones up. Yeah. So the next question is also from Krishnan, and he asked about pet care, because he mentioned pet care as a stress reliever. And he says, could that cause additional stress if...
Pet care? Well, I mean, I guess depends what kind of animal, what kind of pet you have. But but if you have just a cat or a dog, most of them, I mean, I think that you can manage with very little self-care than walking and feeding them, playing with them. But of course, if you live in an apartment, small community, you have a large animal that requires a lot of going out and walking. You can still do that, but be sure that you use the safety, wear your mask and stay, away from people and that kind of thing. So we don't want you to be stressed by having a pet. We want you to, your work to be lessened. So if it's causing you a lot of stress, maybe we need to rethink that.
maybe adopt a senior dog.
Exactly. And something that, an older animal or, a different type of animal. So yeah.
So this question comes from John, and he asks, what are some good sleep tips that you have? What if you take anything, what do you take for sleep?
Yeah, as I said before, sleep is very, very important. And all of us have Parkinson's, the shift in the schedule. So the thing that I notice with patients is that they feel, well, I'm awake, so I might as well keep doing. So they just keep activating themselves and they just keep doing. And so they never allow themselves to take break and get a downtime. So you need to allow yourself that sleep. And like I said, I take Lunesta, but there's a whole, and the 2 new ones just came out, and I don't remember the name. So there's at least 10, 15 medicines that I can think of for sleep. So you can try some of them. I personally like Lunesta and Sonata because they don't have a lot of side effects and they don't interfere with the medicines for Parkinson's, and they don't build up the tolerance like Ambien and some of the other ones do. But the main thing is that you need to allow yourself that time to sleep. So if you do take a sleeping medicine, that you allow yourself that full 8 hours or 7 hours so that you're not waking up in the middle. Of course, then you're going to be more confused and groggy and disoriented because you still have medicine effect, plus you haven't slept. So, so that's the important thing, that you allow yourself the time to sleep, those 6, 7 hours at least every day.
Yeah. Yeah. What are your thoughts on melatonin? I've heard that as
melatonin, a lot of people find it beneficial. It didn't work for me, and even though it works for some people, it doesn't work for the majority of people with Parkinson's. They need something stronger. So it's not going to hurt. You can buy it over the counter. You can take it at nighttime. It does help some with the REM behavior too, but it may not be enough to keep you and put you into a deep sleep so that you can get into the REM state and and actually shut everything down so that your brain can recuperate. So you may need to talk to your doctor about different alternatives for sleep.
Okay. Awesome. Okay, so this next question comes from Suzanne, and she is wondering about memory pills, something for
memory pills. Yes. Well, the first thing that I have noticed as a patient and also as a doctor, that a lot of the memory issues come from the fact that, one, they have vitamin deficiencies. Two, they may have some other underlying illnesses like diabetes, thyroid disease, and lack of sleep. Number one cause, lack of sleep. They're not sleeping, so of course you cannot learn anything new if you're, drowsy and kind of, as a zombie. So if all of that has been taken care of, then lack of dopamine can also cause memory loss. So then making sure that you adjust to the maximum amount of your dopamine so that your brain is activated and learning, because dopamine has a big function in learning. So you cannot learn if you don't have enough dopamine. So make sure that that's active. If you still have memory problems, then after all that, then yes, there's several medications. The only one specific, FDA approved specific for Parkinson's is the and I'm blanking on the name now. Primvasetin. But of course we use Aricept and Namenda and Racidine. All the medicines we use for Alzheimer's, we use for Parkinson's patients as well. So if you need that, then that's something that can be added. Of course, over the counter, I know some people like those over the counter but they're more expensive than the actual medication. So now I can't hear you again.
I muted myself.
Okay.
Your last answer actually kind of leads well into this next question from Helen, who asks, both of my parents had Alzheimer's and I have Parkinson's. Is it possible to have both?
Yes, it is possible. And also some of the Alzheimer's, Parkinson's can be familial. So if you had family that had Alzheimer's and then had Parkinson's, make sure that maybe one of the reasons to get genetic testing, because there may be that gene. And also people that have I believe the LRRK2, the ApoE combination, have the Alzheimer's and can have Parkinson's. So, it's not the big majority, but it can happen. And so you need to treat both. And the main thing is for family risk and parenting and things like that, it's better to get some genetic counseling and testing. So, but talk to your doctor about that. Yeah. And so they may need to treat them on Alzheimer's medicine and Parkinson's medicine. The question is that some of the some of the Parkinson's medicines can worsen the dementia. So that's that balance of trying to figure out what's the right combination.
Right. And it could
be in there. I'm so sorry. God bless you.
No, it's okay. So this question, we're actually going to flip over to our live questions.
Okay.
So again, if you guys have any questions, please feel free to type those into the Q&A tab. We've got Dr. DeLeon here, so feel free to ask her questions. She's a great resource for you. So this question is from Stephen, and his question is, I have sleepiness during day, lack of energy and motivation. Are there remedies?
Yes. One, the sleepiness, maybe again, what is your sleep cycle? Are you not sleeping during the nighttime? You may have shift in cycle or reverse in cycle, like, the shift workers. But the fact that you have some apathy also goes along with probably not maximize on the medicine, not maximize on the dopamine. So need to talk to your doctor about that. That also causes the fatigue. And so need to talk about that. The other thing is that, which I didn't allude to before, but something that happens very often in Parkinson's patients is they can have sleep apnea. So if not been tested for sleep apnea, make sure that that's, tested, because that could cause all of your symptoms if there's sleep apnea. And so that would require a different treatment. So one would be adjusting, your medications, and maybe taking sleeping medicines at night early to sleep. And then sometimes we even give medicines like Provigil or Adderall or something like that to wake you up. So talk to your doctor. Yes.
Awesome. And this kind of folds right into that. How do naps account in the adequate sleep slot cycle?
Okay. How does nap count?
Yeah, napping.
Oh, napping. Well, it's hard because personally, I only find myself, I need a nap when I'm sick. So if you have to kind of know yourself too, what your routine is, but most people, if you have enough sleep during the nighttime, you should not need a nap. I mean, you may require some resting, but not actually sleeping, and I do take rest breaks when your dopamine is kind of, you've been really active, you need to recharge. But if you're napping, and especially napping more than, 30 minutes to an hour a day, and doing it every day, then something is not, either have sleep apnea, not sleeping at nighttime, the medications are causing your sleepiness, or sometimes the medications can also cause the blood pressure to go down, which can make you very sleepy and tired, or up. So, make sure that those things are monitored. So when you get sleepy, kind of check your blood pressure, sitting and standing, see what it's doing. And kind of keep a journal of when this is happening, after you ate, after, did you have a rough night? So this way you can have a better, more focused conversation with your physician.
Right. And this all kind of ties back into your presentation about balancing those medications. I mean, it's a lot.
I can tell you from experience. I can tell you from experience, when I took the dopamine agonist, I was passing out at the wheel. I mean, I was falling asleep all the time. So, and so I switched to Nupro, and which was something that I use in my patients a lot, and I loved. And I wasn't able to start Nupro initially myself because they had discontinued it for a while here in the States. So that's why I tried the Mirapex and that. So as soon as it came back up, I'm like, I'm going on that Nupro, and don't have any sleep issues. So again, it's trying to find that medicine that works just right for you.
Did you find, sorry, this is me kind of going off on a tangent, but did you find it difficult when you did want to try a new medication, speaking with your physician and getting that changed quickly?
Well, no, I think I'm in a unique, position, because I am a neurologist and I am a movement disorders, and my doctor is a good friend of mine. She trained me, so we usually just have conversations, colleague to colleague. What do you think of this drug? What do you think? Of course, and she's very good. Of course, she's very smart, so she always, says, well, maybe let's try this instead. So, but yeah, she's very open. And so when I said, Nupro, I think we should try that back, and she's like, yes, it's finally back. Here.
Okay.
We even talked about it, getting it from Canada or somewhere else. So yeah, having that conversation. That's what I talked about. Make sure that you have a doctor that will listen, and that you can communicate with, and knows you, so that's important. But
having a good relationship.
But also on that other flip side, and I guess this is coming from the doctor perspective and not the patient perspective, that don't start bombarding doctors with a million questions that like the minute you meet them, because they don't know you and they're trying to figure out. And so then that kind of, and, advocate for yourself. But remember, to be courteous, it works both ways. Courtesy works both ways. So, they have knowledge from seeing the patients and you have knowledge from being you and living with your disease. So, you need to mesh that.
Yeah. So it doesn't look like one moment. Let me just make sure that we're getting all of any questions. Okay. So it doesn't look like we have any other questions coming in for you, but I don't want to take up too much of your afternoon. I know. Thank you so much for coming back.
We were saying about pros and cons of taking selegiline.
Oh.
Yeah.
Oh, there you go.
Well, I am very pro selegiline. I still think, and I think most neurologists think that is neuroprotective. I've been on it since day one. And I think it's a great drug. It helps a lot of people with pain. It did me. And it helps tremendously with balance. Doesn't do much for the other Parkinson's symptoms. So the thing is that it doesn't do much for the other Parkinson's symptoms. So people don't really notice like a big effect at the beginning. It's so expensive. So that's where you have to balance, like how much, but I think it is a great drug because it works great in the long term. And like I said, I think it's a great drug for people that have balance issues and falling. I tell you, when I stopped it after like 10 years, because my insurance wouldn't cover it anymore. So I said, okay, well, I guess I'll try the Xadago, which is similar, but a new different. And so as soon as I went off the Acylate, I started falling again like crazy. And so went back on this Acylate and don't fall anymore. So, again, it's something that is worthwhile, especially since we don't have a lot of drugs that help a lot with balance and gait. I think that's something to consider. And also in my case, and I've heard other people mention this too, I had a lot of visual field problems, with the depth perception that you have, and Acylate has corrected that. So, yeah.
Interesting.
Yeah.
Wow.
So I think it has a niche, and I think it's a very good, very important drug. But yes, it is extremely expensive and have to fight with insurance. But if it works for you and you're having those issues, I think it's definitely worth the fighting and getting it, getting and staying on it.
Awesome. Yeah. Thank you. Thank you for that answer. That was great. Yeah. Well, we'll wait for a minute or so, because I know sometimes the Q&A and chat can be a little on a delay. So we'll go ahead and kind of stall. But I want to thank you again for your presentation earlier and for joining us from all the way from Texas.
No, I'm really excited. Thank you, everybody. If you have any questions for advocacy, I know that was not my talk, but if you guys have any questions.
I know. I felt so bad that we broke down, and I think it was just a system overload. So
it's so much.
But
so much
no.
On,
Yeah. Okay. I hope no other questions will come in.
If there's anything else, just text me or whatever, and I'll be glad to give any references or anything. So thank you, everybody.
Awesome. Thank you so much.
Thank you. Bye-bye. Take care.